The Silver Skill test is a test that was described in 1924 to look at Achilles tightness, which would be soleus and gastrocnemius, versus gastrocnemius tightness. Lots of people have both Achilles or heel cord tightness, but we see lots of people with gastrocnemius tightness. And it's not just people with foot and ankle problems, it's people with knee problems, hip problems, all the way up the kinetic chain, including throwing athletes. And the Silver Skill test was described as checking the dorsiflexion of the ankle with the knee flexed and with the knee out extended, but you have to make sure that the subtalar joint is locked. So generally you want to put your thumb or your index finger, depending on which leg you're doing, to make sure that you're not getting dorsiflexion through the subtalar joint, that you're actually getting dorsiflexion through the ankle joint. So I'm going to switch my hand here because it's the right leg, but to make sure that I'm stabilizing her subtalar joint, my thumb at this point is over her medial aspect here, talonavicular joint, and I am trying to maximally dorsiflex her ankle with the knee at 90 degrees. And she's a little bit tight. She's probably 10 degrees. Ideally would be 10 to 20, but certainly at least she can get to 10 degrees. And then when I straighten out the knee, she actually is tighter through her gastrocnemius. She still has a few degrees of ankle dorsiflexion, but less than 10 degrees. So there is a mismatch between her Achilles and her gastrocnemius, and she should do a few more exercises to work through her gastrocnemius, and we actually have those exercises that is linked to this video or part of this diagnostic tip. I also think you can check people actively. So if you ask her to dorsiflex her ankle with her knee straight, you can see that she comes up a little more than neutral or 0 degrees. So she again is tight there, and you can have her actively dorsiflex here. She is better with this than she was with her knee straight, again showing that her soleus is a little looser than her gastrocnemius. So if you do it actively, you have to make sure that people aren't rotating in dorsiflexion through their subtalar joint, but a quick functional screen, you can actually still see people who are tight, and that does translate into knee problems, hip problems, and things up the proximal chain.